For most of this semester, you've heard me say, don't use the terms positive and negative to mean good or bad. I know a lot of us use those terms in our everyday conversation, and we even hear some so-called psychologists and marriage counselors on the radio talk about positive and negative things. Should you be using this in your clinical discourse? What a lot of you are doing instead is you're relying upon chatbots to supply some basic content for your posts. Now, if you believe what chatbots say more than you believe me, well, let's ask the chatbots, is it proper within the practice of medicine to use the term positive for good and negative for bad? Well, let's start with Copilot. It says not always proper. In the practice of medicine, the term positive to mean good is not always proper. Well, let's ask you.com. And it says, in the practice of medicine, the terms positive and negative are not inherently tied to concepts of good or bad. Instead, their meanings are context dependent, particularly in relation to diagnostic tests or medical findings. So, in medical terminology, a positive result typically means that the test has detected the presence of what it was designed to find. So, if you test positive for HIV, it means you've got HIV, according to the test, and that's bad news, not good news. Now, if you're testing for the presence of sperm and your goal is to achieve a conception, a positive sperm count is something good. So what positive and negative mean in a diagnostic context would be the presence or absence of what we are testing for. So that's what we are talking about. Now that's just you.com. Let's take a look at the Gemini chatbot. What does it say about the use of terms positive and negative? No. Within the practice of medicine, it is generally not proper to use positive to mean good or negative to mean bad. And once again, it talks about clinical objectivity and the need for precision and to avoid misinterpretation. Okay, that's pretty clear. My favorite chatbot is Perplexity. Let's see what Perplexity says. Within the practice of medicine, it is not proper to use the term positive to mean good or negative to mean bad. So once again, it talks about test results. Medical professionals are encouraged to communicate clearly and avoid confusion by explaining what positive and negative mean within the context of a specific test, rather than assuming that patients will interpret terms correctly. Remember, you're supposed to be writing in this class as if you were discussing something in front of other medical professionals. Let's work for precise and proper use of medical terminology.